internet live at CVPH MC. That's our Twitter name. If you want to follow us, I'll be periodically asking questions, and you can throw back some answers by using the hashtag CVPHLive. We'll also be streaming this presentation at cvphlive.com, so be sure to check it out. And without further ado, the speaker you all came to hear from, Dr. Zapiri.
Thank you.
Thank you. I really feel honored to have such a large audience, and especially on such a beautiful night tonight. So I'll try to do a good job here. As it says tonight, I'm going to talk a little bit about the role of herbal and complementary medicine in preventing and treating disease. I had actually received a lot of my ideas for this presentation from members of the community. There was one gentleman that called, he may or may not be here, that really was interested in finding out more about herbals in the use for treating diabetes, which, given the incidence of diabetes in the North Country, that was a great idea, so I tried to incorporate some information about herbals used to treat diabetes. I had a cardiac nurse who requested that I provide some information about the use of herbals and alternative medicines for the treatment and prevention of heart disease, so I also included that information. Also, I had at one point a couple years ago, about a year ago, I did a presentation for the Psychiatric Teaching Day, and I covered a lot of the herbs that are used for mood disorders and sleep and things along that line. So I actually am covering a lot of those medications also. There's thousands and thousands of herbals, so I certainly won't be able to cover everything everybody's interested in. But I do have a PharmD student, Alexa Pierovsky, with me here tonight. She's over here. And between Alexa and myself, after the presentation, I did download a very good database to help prepare for this national standard, which I'll talk about. We can try to answer any questions that you have regarding any specific herbal medication. Okay, so now I'll get started. Now my interest actually sparked as far as the use of herbals to treat disease back when I was a teenager, back in the early 70s. And one of the great books that was out at that point was Stalking the Healthful Herbs and Stalking the Wild Asparagus. So I don't know how many people are familiar with those books, but they were great, and I really enjoyed reading those books and going out in the countryside and trying to identify different herbals or different plant treatments. And I was fascinated with it back then, and I still think it's pretty neat. So we'll go over a few different things here. They were great books. Okay, well, the use of herbal and complementary medicine has really taken off in the United States. As we can see, in a 2007 survey of over 23,000 people, about 38% of the people surveyed had used some type of herbal or complementary medicine within the past year. And I'm sure that's even going up from there. In the same year, Americans spent nearly $34 billion out of pocket on complementary and herbal alternative medicine. So like I say, this is really a big business in the U.S. and it's really difficult to know what really helps me, what's worth spending my money on, and what's not worth spending my money on. I'm not going to have all those answers tonight, but I will cover a few things, and hopefully what I cover will be helpful for you. Now, the Natural Standard is a great database that could help you in your quest to find really good information about herbal, alternative, and complementary medicine. Unfortunately, it is a database that does require a fee or like a subscription to it. But they also have a great book. It's about $70 or $80, so it's kind of expensive, but if you're really into it, the book is excellent, and you may want to consider purchasing their book. Also, they do have a lot of actually free information. Every month, they have a newsletter that you can actually get emailed to you that really goes over all the newest developments in herbal medications and alternative therapies that I get an email to me actually at work every month. And it's just an excellent way to keep up with things and to find out what new studies have been happening out there. And it's all very reliable information. The World Health Organization recommended natural standard as the authoritative guide for trying to find out good information about complementary medicine and herbal medications. And the nice thing is that a lot of people who are a lot smarter than me have gone through all of the studies in natural standard, and they've actually classified the different herbals and their benefit regarding the level of scientific evidence that's available. Now, for if a herbal product or alternative therapy gets a level of evidence A, that shows that there's been really strong randomized controlled trials to show that, yeah, this is really effective. Randomized controlled trials are really the gold standard as far as the level of evidence that shows whether it's a prescription drug or any type of compound really has an effect. It may be compared against placebo, it may be compared against another medication, but it would be double-blinded, so it eliminates a lot of bias. So there are herbals that have been tested with randomized controlled trials. If they've done well in the randomized controlled trials, they get a level of evidence A. Now, level of evidence B is also very good. Maybe there was a excellent meta-analyses or potentially maybe 1 or 2 randomized controlled trials. So that's also considered strong evidence. So A and B, just like our report cards, are good. C, it's a little more conflicting evidence, so we're not really 100% certain one way or the other. As we know, D's and F's aren't very good. So as we go through the different medications that I'll be covering, I'll assign the level of evidence so you know what the experts at Natural Standard have actually assigned this. And it's actually faculty at Harvard Medical School that actually that go through a lot of these studies, and they'll actually compile what is the level of evidence, and that's kind of where this information comes from. So it's very, very good information. Again, so Natural Standard is excellent. Now, another fairly decent reference for those of us that may not want to spend a lot of money and get a subscription to Natural Standard. Bedscape actually is available as either it can be downloaded to a smartphone or it can be downloaded to your computer. And Medscape also has good information about both prescription drugs and herbal medications that you can get that information from Medscape for free. So that's another source of information, not quite as comprehensive as Natural Standard, but another fairly decent source of information for you. Okay, so number one, I'm going to go over some herbals that have been studied in the treatment of diabetes. Now, as a caveat to this, when I talk about diabetes in this lecture, I'm primarily referring to type 2 diabetes. Type 1 diabetes is essentially the individual just is not producing insulin, so they just need their insulin replaced. Type 2 diabetes, as we know, is a little more complicated. There's insulin resistance, and it's a little bit different picture. So I'm primarily referring to medications that could potentially be beneficial for patients with type 2 diabetes. Now, the first one I'll talk about is alpha-lipoic acid. And alpha-lipoic acid is actually made naturally by our bodies, and it kind of protects us against cell damage in a variety of different conditions. It's actually contained in a lot of the different foods that we eat, including spinach, broccoli, and yeast. And interestingly, there have been a lot of studies that have shown that alpha-lipoic acid actually can improve blood sugar levels among patients with type 2 diabetes, and actually is given a level of evidence A. So that's pretty good. It's as good as you can get. Although studies were probably fairly small, and we probably do need higher quality studies to have more definitive answers about the place in treatment where this agent really belongs. And I won't get too deep into this scientific slide because really who wants to be looking at this, right? But alpha lipoic acid essentially is working right here, and essentially it works in the antioxidant regeneration pathway, and it kind of helps recycle vitamin E and vitamin C, and it also helps to increase levels of dihydrolipoic acid or glutathione, which is a powerful antioxidant agent in our mitochondria, the energy-producing part of our cells. So it does have some good science behind it. It can be attained either in all these good fruits and vegetables here. So we see eating good fruits and vegetables, eating lots of really good healthy fruits and vegetables really has an impact above and beyond really just the food itself. I mean, there's a lot of different compounds in all the vegetables and fruits that we eat that really, we're just really starting to understand. And it's just amazing that like alpha lipoic acid is in the fruits and vegetables, and that actually helps lower our blood glucose. So that's pretty neat. Or it can be taken, of course, as a supplement. The usual dose for blood sugar reduction is 600 to 1800 milligrams per day in divided doses. So like 600 milligrams 3 times a day might be used. It also has been shown to be effective in treating diabetic neuropathy. The painful diabetic neuropathy occurs when blood sugar levels have been high for prolonged periods of time, and it causes damage to our nerves, and that can be very painful. And alpha lipoic acid has been shown to have some benefit in relieving pain associated with this nerve damage. Now, this would be in either type 1 or type 2, patients with type 1 or type 2 diabetes. And that level of evidence is a grade A level of evidence. Now, the one thing we have to keep in mind with any of the herbals, they're really essentially almost like a drug. So we really have to watch out for things like drug interactions and side effects, combination therapy, all these little things that we really have to be careful about, or we may end up doing more harm than good. So it's really important to speak to your provider, particularly if you're on other medications for diabetes. It's always important to work as a team with your other healthcare professionals in order to do the best thing, and that's always the safest and the best thing to do. Because alpha lipoic acid can lower blood glucose, so if you're on other medications that can lower blood glucose, that could potentially cause hypoglycemia, which can be very dangerous, as we know. So when a patient starts on the alpha lipoic acid, it's important to monitor blood sugars very carefully. And then potential other drug doses may need to be adjusted. Alpha lipoic acid can also affect thyroid function. So caution is advised for patients who have hyperthyroidism or hypothyroidism. And again, it would be something that one would want to work as a team with their healthcare providers to make sure their thyroid function tests have been performed while taking alpha lipoic acid, and making sure that any adjustments that need to be made are made. Also, alpha lipoic acid does have certain interactions. It can interact with cancer treatments, antibiotics, drugs used to treat osteoporosis, and drugs that help widen blood vessels, such as the vasodilators. So again, there's a lot that we do have to worry about when we take different herbal medications. They're really just something that we all have to be very careful about taking anything like that. So fortunately, though, a few side effects have been reported with alpha lipoic acid. The most common tend to be nausea, vomiting, or dizziness, particularly with the higher doses. Also, it's recommended to avoid it in patients with thiamine deficiency, particularly patients who may be suffering from alcoholism, because they tend to be thiamine deficient. Okay, the next herbal agent that I'll be going over is ginseng. Ginseng is referred to as an adaptogen, or an agent that helps the body to return to normal when it's exposed to stress. The term ginseng refers to several species of the genus Panax. It's been around for a long time, over 2,000 years, and ginseng really has its roots in Chinese medicine. The two most commonly used species are Asian ginseng, which is cultivated, and American ginseng, which is also both either harvested from the wild or cultivated. So Asian ginseng and American ginseng. Now, as we can see below, there is a level of evidence B when used to treat type 2 diabetes with ginseng, so it is pretty interesting. The best evidence seems to say that ginseng can actually help lower one's preprandial or pre-meal and postprandial or post-meal blood glucose. It may not have quite as much effect on the morning fasting glucose, but it does have a benefit in lowering the pre-meal and after-meal blood glucose levels, which is excellent. And it tends to do that in patients with or without diabetes. And the results are particularly promising because it tends not to lower the blood glucose level too low and cause dangerous hypoglycemia. Unfortunately, again, the long-term effects really are not that clear, so we don't really have a lot of good dosing information for its use in lowering blood sugars. Ginseng is available in capsules that contain 100 to 200 milligrams of the extract, and that dose has been used once or twice a day for up to 12 weeks to lower blood sugar. Also, the Panax ginseng tea has been used for the same purpose. And I know this is a lot of information, and there's a lot to write down here. I'd be more than happy to email the slides of all this to whoever would like those. So that I'd be happy to do. So I know everybody's been writing away, but if you just leave me your email address after the presentation, that's something that we could easily do. So again, there's a lot of different ways to take ginseng. A tea is always nice. It seems like a more natural way to do it than taking it in a pill or something like that. Some sources suggest consuming ginseng tea 3 to 4 times a day for 3 to 4 weeks. Again, these are all things you'd really want to do in conjunction with your healthcare provider. There's also a potential benefit of ginseng with the brain. It can actually, there have been reports that it may modestly improve thinking and learning. It probably won't make it any of us Einsteins, but we can at least try, right? So, particularly these effects have been reported with a combination of ginseng and ginkgo. And the level of evidence is C, kind of conflicting. There have conflicting studies with the use of ginseng for treatment of dementia. With mixed, again, different studies had different results, kind of a mixed results. Also, a review of several studies showed that ginseng can actually help improve mood and anxiety in postmenopausal women. Again, additional studies are needed. And like any other substance that we take into our body, again, we have to be kind of careful. Ginseng can increase the risk of bleeding, particularly when it's taken with other drugs that increase the risk of bleeding. Examples of different drugs that increase the risk of bleeding include some of the antiplatelet agents such as aspirin and Plavix, and then some of the anticoagulant agents such as warfarin or Coumadin, heparin, Lovenox. If you're taking any of those medications, I would definitely not take ginseng without talking to your physician about that. And honestly, if you're on warfarin or anything like that, I just wouldn't bother with it because it's just not worth the increased risk of bleeding. Even some of the non-steroidal anti-inflammatory drugs can potentially they have some antiplatelet effects. So even with those, you can have an increased risk of bleeding. Taking ginseng, plus the non-steroidal anti-inflammatories like Motrin or Aleve or ibuprofen, with any of those can have effect on your platelet function. And interestingly, there's also a potential interaction with warfarin where it may actually reduce the efficacy of the warfarin or Coumadin. So again, if you're on Coumadin, I would just stay away from it for a lot of different reasons. If you really had to, I would want to be very closely monitored by your doctor. But it's just not worth the increased risk of bleeding. Interesting too, it can also has effects on blood pressure medications, particularly the calcium channel blockers, such as nifedipine and others. It even reported that reduced the effectiveness of furosemide, a potent diuretic water pill. And there was a Chinese study that showed that it actually increased the levels of digoxin in the body. So again, there's a lot of drug interactions. It's almost, I mean, it's pretty much like the regular drugs to a certain extent. They have to be really used carefully. So the recommendation is not to combine ginseng with heart or blood pressure medications without talking to your qualified healthcare provider first. It even has some effect on your heart rhythm. Now this is very interesting. There's a lot of drugs and a lot of information has come out on drugs, and pharmacists really, we tend to pay a lot of attention to this, about drugs that can prolong your QT interval. Your QT, this is like a normal EKG, but you can see that T wave is way out there. Your Q wave is your first wave that goes down, a downward spike. So usually that T wave is a lot closer in. Now, ginseng and a lot of other prescription drugs can prolong the QT interval. Now, the significance of this is that if you put too many of these drugs together that combine the QT interval, that can cause torsades de pointe, which is a fatal ventricular arrhythmia. So that's not a good thing. You may not have much of a chance to get resuscitated from that if that happens. It happens pretty quickly, and that's the kind of thing that we want to avoid at all costs. So some people actually are at more risk for QT prolongation than others. We can't always predict. Some people have a congenital QT prolongation syndrome. Their QT interval is just longer than other people. So if you add on this drug plus maybe you're taking an antibiotic that prolongs the QT interval, which a lot of them do, you could really run into trouble. So it's kind of scary stuff. So again, caution, working with your doc. If you have any if you're on any other medications, making sure that they do not prolong your QT interval. Ginseng is usually pretty well tolerated. Saying all the bad stuff that I said is usually pretty well tolerated. Long-term use could be associated with skin rashes, itching, diarrhea, loss of appetite, anxiety, depression, insomnia. But again, generally it's pretty well tolerated. Less common side effects reported include headache, fever, dizziness. There's a list there. One thing, for patients with bipolar disease, it can precipitate manic episodes. Okay, now, that's pretty much what I'm going to cover with medications that are used to treat diabetes, herbal medications, complementary medications. There's probably a lot more, but they were the ones that showed the greatest level of evidence when I looked at natural standard. Now I'm going to shift over a little bit to heart disease. And as far as preventing heart disease, primarily preventing heart disease is what I'll be, medications that can help with that, or herbal treatments, alternative treatments. I'm not even sure if omega-3 fatty acid is an alternative treatment anymore. It's really a pretty effective way that you can help keep your heart healthy. Now, just to kind of clarify, when we talk about omega-3 fatty acids, sometimes it gets kind of confusing, at least for me. Now, fish oil contains two different substances that contain omega-3 acids. The DHA and the EPA are the omega-3s that are contained in fish oil. Now, in the more plant sources of omega-3s contain a different substance, it's alpha-linoleic acid. And that's contained in nuts, particularly walnuts, vegetable oils like canola oil. It's contained in flaxseed oil, olive oil, and others. So that's a little bit of a difference there. Now, and it gets very, very confusing. Again, I've been confused with it. How much omega-3 is in a product? You go to the store, and these are products that I took out of our kitchen shelves that my wife has purchased. So it's just products available in the community. The first one was a flaxseed oil product that my wife takes, Member's Mark. It probably came from Sam's Club. And the strength on that is a 1,300 milligram capsule, but it contains its omega-3 content is 845 milligrams. So that gets confusing. Now, another medication that we had in our kitchen cabinet was fish oil capsules, nature-made fish oil capsules, a pretty common brand. And in a 1,200 milligram capsule, that contained 350 milligrams of omega-3 fatty acids, the EPA to DHA. So that's really the active component, is that EPA, DHA, the 350. Now, there's a prescription brand of fish oil that's used to treat very high triglyceride levels. It's called Lovaza. Now, that's a 1,000 milligram capsule, but just about the whole 1,000 milligrams is EPA, primarily EPA and DHA. So that's where it gets a little bit confusing. So I wanted to go over that. Now, one thing to keep in mind is that if we like our fish, we're probably getting plenty of omega-3 fatty acids. Now, I'll be going over the American Heart Association recommendations, but we can get a lot of omega-3s by eating some of the cold water fish products, the salmon, the sardines, herring, and I'll show you exactly how much omega-3s these fish have. Also, for the alpha-linoleic acid component, the canola oils, the flaxseed oil, walnuts, soybean oil, all those contain the omega-3 fatty acids. There's a lot of food sources, even pumpkin seeds. So we should definitely recycle our pumpkin seeds at Thanksgiving time, Halloween, right? Soy and tofu also contain omega-3s. And even green leafy vegetables, there they are again, they actually contain omega-3s. As well as venison, so that's really a good reason, I guess, for our hunters to be out there. Venison's a very healthy meat. It has very little fat, and it contains omega-3s. And buffalo. And even eggs, we'll find eggs in the supermarket that have omega-3 fatty acids now. So there's a lot of good sources for these, and they're very healthy. Again, you can kind of see the omega-3 content. I'll kind of read a couple of them, but salmon has 1.8 grams per 3-ounce serving. So that's a lot of omega-3s there. In salmon, sardines have a lot, herring, 1.2 grams per 3 ounces, trout, rainbow trout, 1 gram, tuna, white canned tuna contains 700 milligrams in a 3-ounce serving. So that's a lot of omega-3. We can see sources of the alpha-linoleic acid, such as the flaxseed oil contains a lot. Quarter cup of walnuts is a great little snack there. Look at all the omega-3s in a quarter cup of walnuts, 2.7 grams. There's something to be said about the Mediterranean diet and all the good foods like the walnuts that people eat, the nuts, the berries, everything else, that the fish. And everything looks pretty good there when I look at it. But even like I say, even the eggs contain a great deal of the omega-3, the enriched eggs. Those eggs contain 223 milligrams of omega-3 fatty acids per egg. So I guess these are the kind of foods that we should be eating. Okay, so the benefits. There's really a lot of evidence to show that omega-3s are beneficial for our health. So essentially, particularly from dietary fish or even the fish oil supplements, they definitely lower triglycerides, without a doubt. They're very good at that. They can actually reduce the risk of death, heart attack, dangerous abnormal heart rhythms, and strokes in people with known cardiovascular disease. So if you have cardiovascular disease, certainly something to talk to your provider about, that this can have a definitive benefit, particularly eating the fish, eating a good diet like that. But it's something even for primary prevention is also very beneficial. Primary prevention is for people that don't have cardiovascular disease. It still has a lot of benefit. It tends to slow the buildup of atherosclerotic plaque, or hardening of the arteries. And it even lowers the blood pressure slightly. But we still have to be careful. Like anything else, it's not perfect. And it can potentially increase the risk of a serious bleed. So that, particularly the higher doses. So we do have to be careful. There's a lot of drugs that we wouldn't think increase the risk of bleeding that actually do. Some of the drugs that do above and beyond the antiplatelet agents, which are pretty obvious, like the aspirin and the Plavix, and the anticoagulants like the Coumadin and Lovenox. Even some of the antidepressants that we commonly use, such as the SSRIs like Celexa, Lexapro, Prozac, they can actually affect platelet function and increase the risk of bleeds. So a lot of times, we combine multiple different agents that increase the risk of bleeding. You know, people end up in the ICU with a GI bleed or something. So it's something that we really do have to weigh the risks and the benefits for each patient on an individual basis. And interestingly, although similar benefits have been proposed with the alpha-linoleic acid, the plant source of the omega-3s, the scientific evidence tends to be less compelling with these agents, and the beneficial effect may be less pronounced. And I thought it was pretty interesting that omega-3s actually do help to lower blood pressure. They're fairly small reductions, but they actually can help to lower blood pressure a little bit. Unfortunately, the doses that are required to do this are usually on the higher side, and that does significantly increase the risk of bleeding. So again, checking with your provider regarding the safety of this is always a good idea. And it is a grade A level of evidence that omega-3s will help to reduce blood pressure. So they're having good studies done on that. We also know that there's very strong scientific evidence to show that omega-3 fatty acids reduce triglycerides. So if you have high triglycerides, this may be something that you could talk to your doctor about taking some omega-3 fatty acids. And that could potentially reduce your risk of having a heart attack. The benefit appears to be dose dependent on the prescription strength. Again, is usually you're taking quite a bit of omega-3 fatty acids with the Lovaza. Pretty high dose to get those triglycerides down. But the fish oil supplements also, above and beyond reducing your triglycerides, do have some benefit in increasing the good cholesterol in our blood, the HDL, and that's also very beneficial. Unfortunately, the fish oil tends to increase the bad cholesterol, the LDL, so that's a downfall there. So, and it's really important to have our LDL at goal at the right level. So again, this is something that you would need to work with your doctor to make sure your LDL gets under control, maybe with a different drug therapy if it's high, before starting the fish oil, because you don't want to increase your LDL. That could do you a lot more harm than good. So again, working with your provider, weighing the pros and the cons with the bleeding, and at that point making a good decision. The level of evidence is grade A for the treatment of high triglycerides with fish oil. Very good studies done. Now I'll talk about secondary prevention of a heart attack. Secondary prevention essentially means a person's already had a heart attack and we're trying to prevent a subsequent heart attack. So there have been several well-conducted trials that show that in people with a history of a heart attack, regular consumption of either fish oil supplements or fish, oily fish, does reduce that risk of a non-fatal heart attack, a fatal heart attack, sudden death, and all-cause mortality, which is death due to any cause. So it reduces the chance of dying. Interesting, and of course most of the people in these studies were receiving the conventional medications used for patients to prevent heart attacks, such as the beta blockers, like Toprol and others, and the statins. And this gave a benefit above and beyond those medications. For primary prevention, there have been several large epidemiologic or population-based studies, which are not as strong as the randomized controlled trials, but they're still good. And these studies have reported a significantly lower rate of death from heart disease in men and women who regularly eat fish. Some epidemiologic studies haven't shown this. So again, that conflicting level of evidence. We don't know if it really just helps people who are at higher risk of having a heart attack and maybe not the people at lower risk. So there needs to be more studies and more research there. But suffice it to say, for primary prevention, we still have a pretty good level of evidence B here. So that's pretty good. Again, though, we do need to have more studies, look at different populations, stratify patients by risk to see if we can do a better job of finding out who it helps the most. Now, the American Heart Association does say go fish. They recommend eating a fatty fish at least twice a week. That's their recommendation. One serving is about 3.5 ounces of cooked fish, or about 3/4 a cup of flake fish. So twice a week, eating a good fatty fish. We all know that from TV and everything else from reading. So salmon, mackerel, sardines, albacore tuna are all high in the omega-3 fatty acids. But if we start taking higher doses, then we really need to be consulting our doctor. Like I say, if someone's taking more than 3 of the fish oil capsules, over-the-counter capsules, at that point, we really need to be consulting with our primary care provider to make sure that we're not increasing our risk of bleed or increasing our LDL or something along that line inappropriately. Again, that high intake, according to the American Heart Association, can cause excessive bleeding in some people. Even the World Health Organization recommends some type of supplementation, and they're saying about 0.3 to 0.5 grams of EPA, DHA. That's about 1 to 2 capsules, or about 0.8 to 1.1 grams of the alpha-linoleic acid. That's one of those big capsules daily. We talked about the bleeding risk and making sure if we're on any medications that cause bleeding, we consult with our doctor before taking these. Okay, now we're going to switch over to garlic. Garlic's been around for thousands of years. In ancient China, it was used to increase energy. It's still used throughout the world. Lots and lots of garlic. Unfortunately, it does have some side effects, as we can see up in the right there. And it really is kind of referred to as the miracle herb. I guess it can do a lot more than we really think it can do, as far as even potentially keeping the vampires away there. As we know, it's a culinary herb that's been used to treat and prevent both cardiovascular disease and cancer. There's been numerous controlled trials that have looked at the effect of garlic on our lipids in our blood, our HDL, our LDL, and our triglycerides. Long-term effects on lipids and cardiovascular morbidity and mortality, so either the risk of death or the risk of having like a heart attack or something like that, essentially remains unknown. But garlic has been shown to produce small reductions in blood pressure, so that's not a bad thing. That's a good thing for most people. It can cause small reductions in blood pressure. It can inhibit platelet aggregation or platelets from sticking together. That's another really good thing to prevent clots. And it also enhances fibrinolytic activity, which means it enhances the breakdown of clots, and that can also be a good thing to protect us from heart attacks. It actually has a level of evidence A for its ability to reduce blood pressure. It has a modest benefit, but it has some effect there. And it even has a level of evidence grade A that it can reduce total cholesterol as well as the LDL, the bad cholesterol, the low density lipoprotein cholesterol. And that study was over 4 to 12 weeks. We're not exactly sure what it does to the good cholesterol, the HDL. And there is a grade level evidence B, which is still pretty strong evidence, that garlic may prevent future heart attacks. Also, as far as cancer prevention, there have been numerous case control and population-based studies. They're not as strong as randomized controlled trials, but they're still pretty good, suggesting that the regular consumption of garlic can reduce the risk of developing several types of cancer, including gastric cancer and colorectal carcinoma. That's a level of evidence C, so again, it's still some conflicting evidence there, so we're not really sure on that one. We need more studies, but the World Health Organization, again, has come out with recommendations that recommend about 2 to 5 grams of fresh garlic, that's about a clove, or else the dried powder, the extract, or another formulation that contains about 2 to 5 milligrams of allicin, which is the main ingredient, the active ingredient in the garlic. Another medication that's used for treatment of heart disease and other things like that is coenzyme Q10. Coenzyme Q10, or CoQ10, is produced by the human body and is necessary for the basic functioning of cells. Its levels are reported to decrease with age and to be low in patients with certain chronic diseases such as heart conditions, muscular dystrophy, Parkinson's disease, cancer, diabetes, and HIV disease. Interestingly, again, coenzyme Q10 has been shown to reduce blood pressure in small amounts. It will reduce the systolic, which is the top number, and possibly the diastolic blood pressure, the low number. Level of evidence, grade B, for that recommendation. Interestingly, low blood levels of coenzyme Q10 have been found in patients with hypertension. Unfortunately, we really can't make the assumption that the low levels of coenzyme Q10 are responsible for the hypertension, but somehow by replacing the coenzyme Q10, we do tend to have a little bit better control of blood pressure. Again, we need more studies here. And again, this is kind of a busy slide. But this slide kind of goes over the role of coenzyme Q10 in helping to prevent statin-induced muscle damage. The evidence really is not 100% clear in this area, so I kind of hesitate to bring it up, but there could be some potential benefit, and it usually doesn't cause any harm, but there's a lot of conflicting studies regarding this. But the theory is that when we give a statin, the statin's up here, it's a HMG-CoA reductase inhibitor. It's inhibiting this enzyme, so anything downstream we have less production of. One of the things that we have less production of is this substance right here, which is actually the coenzyme Q10. So the hypothesis is that by depleting the coenzyme Q10 necessary for muscle function, it could cause potential problems in our skeletal muscles. Now, most people don't have muscle aches and pains when taking the statins. Common statins include Zocor, Lipitor, Crestor, Pravastatin, Simvastatin, are all statin drugs used to lower cholesterol. But some people may have some difficulty with muscle pain, and there is a hypothesis that the coenzyme Q10 can help treat or prevent that, but again, the evidence is not solid. But again, like I said, there's little harm. There's not really a great dose range on that. If anybody's interested in that, I can try to do some more research to get the best dose. The level of evidence, again, is conflicting. Level of evidence C. And again, just throw your email address on a piece of paper up on the table or whatever, and we'll be happy to get these slides off to you too. As far as coenzyme Q10 interactions, coenzyme Q10 can reduce the effectiveness of Coumadin. It can reduce blood pressure, so if we're taking other medications that lower blood pressure, it could cause a dangerously low blood pressure, hypotension. Side effects are typically mild and brief. They may include nausea, vomiting, stomach upset, heartburn, dizziness. There's a whole list of increased sensitivity to light. So if you do take the coenzyme Q10, watch out for these. And it actually may lower blood sugar levels. Okay, I guess that's enough for heart. Now the next thing I'm going to talk about this is an example of one of the new studies that was presented in Natural Standard and their monthly newsletter. I thought it was great. I think green tea is one of the best things going from a lot of the things I read on Natural Standard. So essentially, green tea, there was a recent study showing that green tea may reduce the risk of disability in old age. The study looked at about 14,000 Japanese elderly individuals over 70 years old. It looked at the green tea consumption, and it also looked at the occurrence of disability. The authors reported that there was a 10% reduction in the occurrence of disability for individuals who drank 1 to 2 cups a day. There was a 25% reduction in disability for patients or for individuals who drank 3 or 4 cups of green tea per day, and a 33% reduction in disability for individuals over 70 who consume 5 or more cups a day. So that's pretty impressive. How does it help us? Well, green tea is rich in a class of polyphenol compounds. And polyphenols tend to have health benefits in humans. Now, traditional health claims for green tea show that it does improve urine flow, relieves joint pain, and improves resistance to disease. Now, if we're drinking 5 cups of green tea today, we're definitely improving urine flow. Now, green tea has also been studied as far as its ability to prevent depressive symptoms in elderly individuals. And its use has been associated with reduced incidence of depression in the elderly. There was a study, a cross-sectional study, in over 1,000 community-dwelling elderly adults in Japan who were at least 70 years old. And researchers found that for folks who drank at least 4 cups of green tea per day, there was a 44% reduced risk of developing depression compared to those who drank less than 1 cup per day. So I know I have to stop drinking so much coffee and drink more green tea because it does have a lot of benefit here. Again, we need more studies to confirm these. Okay, now I'll go over some other interesting compounds. How's my time going?
7 o'clock.
It is 7 o'clock, okay. At this point, should I go maybe 5 more minutes? Would that be good?
Yeah.
Okay. Okay, we'll talk about a couple things, and then there's a couple other medications in there that are kind of like the Kava that you can just kind of read over the slides if you'd like to. We'll talk about Kava. Kava is actually pretty good for treating anxiety as a level of evidence A. Kava is made from the dried roots of the shrub that's shown on the right there. It's found a lot native to the South Pacific region. We can show that there's the South Pacific natives around the Kava bowls. Kava has been used a lot as a beverage for social, ceremonial, and medicinal use in the South Pacific. There are actually Kava lactones, and these lactones are associated with modulation of serotonergic and glutamatergic systems. What that means, that we know serotonin is kind of our feel-good neurotransmitter, so it's kind of helping it maybe increase those serotonin levels or modulate those serotonin levels, and it's also modulating levels of glutamate, which is a stimulatory neurotransmitter, so it's kind of revving that down a little bit. So because of that, it's having this anti-anxiety effect. It also works on another neurotransmitter, dopamine. It works against dopamine in the brain. And it enhances GABA activity. GABA is a neurotransmitter in our brain that kind of causes relaxation. So it makes sense that by enhancing GABA activity, we're going to relax a little bit more. Side effects tend to be mild, transient, and infrequent. Unfortunately, Kava has been associated with some liver problems, hepatitis, cirrhosis, and liver failure, even causing the need for transplantation. The FDA had actually issued an advisory in 2002. Later, research suggested that some non-standard inclusion of the Kava's plant bark preparation increased the toxicity level. But again, there's a lot that we just don't know about Kava as far as, did the patients have pre-existing liver disease? Were they on other medications that were toxic to their liver? Or what was going on there? So the recommendation is definitely work with your provider. If you have any pre-existing liver disease, definitely do not use it. Or if you're taking other medications, even the common statins that can affect the liver, or Actos for diabetes, you really shouldn't be taking Kava. I think at this point, given the time that we have here, I'm going to call it quits and open up for questions here. Does anybody have any questions? It's a lot of material. Yes?
Well, some of these antioxidants and supplements be provided to us through our medical center, pharmacy, like a prescription shop.
They could definitely, we could definitely work on trying to get some of those in that people are interested in taking. I'm sure they'd be more than happy to do that.
And should I ask them to research a specific, what was it, a national standard herbal? Would they need direction for that to go through a national standard, the herbs from that particular company, or?
Natural Standard is actually, that's pretty much just a database. It's an informational website that contains excellent information on the herbals, but they don't do anything with the financial part of it as far as selling herbs or anything, which is good because we don't want somebody providing information that has a financial interest in selling those. We want someone providing good, solid information with no financial interest whatsoever. I have no financial interest in herbals, either for or against. Just I probably should have said that in the beginning, just so people know too.
Thank you.
Yeah. And yes.
You mentioned with the alpha-lipoic acid
Yeah.
that it could affect thyroid function.
Yes.
Now, in what way? Would it lower or raise the thyroid?
It might cause either.
Either one.
Yeah. So I would definitely, if you do use that, your doctor can check your TSH levels. And that would give him a good indication, a baseline, and then after taking it for maybe a couple weeks, and then at that point you'd be able to tell if that was having some effect on your thyroid function.
Thank you.
Sure, yes.
You mentioned that omega-3s can increase bleeding risk with certain antidepressants,
Yes.
and I am on some antidepressants. The one I'm on, medications I'm on, you did not mention, so I was kind of...
Most of them do affect serotonin levels, and I can double check specifically for you too on that.
Okay, I'm on an SSRI.
SSRIs usually do, the selective serotonin reuptake inhibitors do affect serotonin levels in they affect the serotonin function in the platelets, and it tends to make the platelets not stick together. So a lot of people don't know that. Even physicians a lot of times kind of forget about that. But you do see people coming in to ICUs with bleeds who are on SSRIs and this and that, and everything just kind of adds together. And all of a sudden there's a problem. It's kind of scary. So, I would say if someone was taking an SSRI, lower doses, like, eating the fish 2 or 3 times a week is never an issue.
Yeah,
Or,
I'm actually on a low dose. And
Yeah.
I was actually prescribed orally the low dose for bipolar disorder.
yeah, and so just not going overboard with the fish oil. Maybe, no more than maybe a couple capsules a day, or fish 2 or 3 times a week, or something like that. Still be very safe, I think.
That's what I guess I didn't really make that clear. I was actually told to take fish oil